A Cobra meeting on coronavirus, and I think it's very important to stress that this is a problem that I think is likely to become more significant for this country in the course of the next days and weeks, and therefore that we've been making every possible preparation for that, and this country is very, very well prepared. We've agreed we've got a fantastic NHS, we've got fantastic testing systems, amazing surveillance of the spread of disease, but we've also agreed a plan so that as and when, if and when it starts to spread, as I'm afraid it looks likely that it will, we are in a position to take the steps that will be necessary will be reasonable, will be possible to contain the spread of the disease, and as far as we can, and also to protect the most vulnerable. And we'll be developing that plan or announcing the details of that plan, not just tomorrow, but in the course of the days and weeks ahead as the thing develops. Now, don't forget, Laura, that it is still the case that the single most useful thing that we can all do to support our NHS to stop the spread of coronavirus is to wash our hands. 2 times happy birthday, hot water and soap. Other than that, though, I wish to stress that at the moment it's very important that people consider that they should, as far as possible, go about business as usual.
You say, however, this is likely to get more significant. Your Health Secretary said we should prepare for the worst. What is the worst? Because people are worried. You'll
have seen there are all sorts of projections of where it could go, and you'll have seen what happened in China. But our job is to protect the public, and we think that we've got a very good plan, a very good way of telling how and when to take the steps necessary to stop the spread of the disease.
When would that be, though? I mean, actions like closing schools or cancelling. When is that trigger?
Well, I think the most important thing for people to understand is that will be governed by the scientific advice. That's the crucial thing. So the Chief Medical Officer, the Chief Scientific Advisor, of all the 4 nations of the UK, by the way, are working very closely. The Chief Medical Officers of the devolved administrations are also involved in this. They will be helping us to take the key decisions, and the decisions about when and how to take protective steps will be led very much by the scientific advice.